Why, thank you, Harry, and welcome everyone to today's program where we're going to cover the CMS section on nursing that appears in the conditions of participation. And this is a pretty timely webinar for two reasons. First of all, I'm going to show you where the April report shows there's 3,997 deficiencies, and just yesterday they came out with the report, so now it's way over 4,000. And it's also timely because CMS is proposing to promulgate some new changes to the nursing COP, so we'll be able to talk about both of them. And then on slide 2, I always give you my phone number, and if you have a question, you can give me a call. I don't accept emails because sometimes I don't get them or I don't understand them, but if you call me, I'm happy to help. Also, on the bottom of slide number 2, you will notice that there is now, this is new, an email address that you can email directly to CMS and ask the question and get it directly from the horse's mouth. And I use that about 25 times because it's very helpful, because I can tell you what they say and I can tell you what they don't say. So let's just jump right in and get into an introduction. And this is what is known as a deep dive series or survey readiness program, because we don't want you to get one of these. This is a bad thing to get in the mail. It's a statement of deficiency, and then you have to do a plan to correct it. Now, nursing is one section in the 525-page manual, and most people just refer to this 525 manual as the COP manual. Sometimes you'll hear people refer to it as the COPs manual. It stands for the conditions of participation. You will also hear people refer to it as the SOM. Don't be confused. It's the same thing. That stands for the State Operation Manual. And I know that's a little confusing, but because it's the same one for, all 50 states. And these, the COP manual has section numbers or tag numbers, and they go from 385 to 413. And how they end up into the CMS 525-page manual is step number 1. They publish things in the Federal Register, and you can sign up to get it for free if you want, have maybe 1 or 2 people do that. And then when it's final, CMS will publish the interpretive guidelines, so the surveyors will know what it means, and we as hospitals will know what it means. Some of them, not all of them, have a survey procedure. Go look at this policy. Go ask that question. And because we have seen a lot of changes over the past few years, it is handy if, because what we're telling you is current as of today. In the future, if you have maybe 1 or 2 people that can sign up to get the Federal Register, it's free. Maybe have them go out and check to see if there are any new survey memos, and check to see if there is an updated manual. So let's look at slide number 6. On slide number 6, so as I'm walking you through the CMS nursing standards, and I'm giving you, each of them will have a tag number. And if you say, something, I'd really like to look at tag 392,